Life, wisdom.
I'm Psyche Truth correspondent Karina Rachel. Thank you for tuning in to The Truth Talks. I'm joined today by Dr. Jeff Echols. He is a practicing chiropractor in Austin, Texas. And today we're going to narrow it down to the 5 worst things that we can do for the health of our spine. So these are the 5 worst things that are going to lead to back pain, lead to back problems, the 5 things we definitely want to avoid doing. So I want to start by asking you if you're experiencing back or neck pain, or if you ever have experienced back or neck pain, and if you've ever had a chiropractic adjustment. Thank you so much for joining me.
Thank you. Great to be here, as always.
So we've done several videos talking about chiropractic, talking about pain pills and whether or not that's healthy. We've covered a lot of ground, and I was wondering if in this video, if you can just kind of narrow it down to what are the 5 worst things that people should know, that they should avoid doing, that can really improve the health of their spine and hopefully prevent back pain.
Well, I think the number one thing is that people should realize that their spine is an organ, right? Just like your skin is an organ and all these other organs in your body, and we do things to take care of them. You got to do some things to take care of your spine too. But normally people just go and go and go and do a lot of things until finally they end up in kind of some trouble, and then they try to hurry up and fix it, or they take pain pills to alleviate the problem. And I see that a lot. So if we realize that, your spine is an organ, just like your skin is an organ, you actually need to take good care of it. Women spend a lot of money on their skin. I know they spend a lot of money on those products, and because it doesn't really hurt, but everybody's seeing that, but nobody really sees the spine. But if you'll just take good care of that spine, and we can talk about some different ways that we want to do that.
Okay. So maybe tip number 1 is don't let pain just go and go and go. I know everybody says, oh, everyone has back pain. Like we're just supposed to live with it. But really and truly, you want to address that pain. You want to take care of the spine and just do the general maintenance. And I like the way you compare it to, we do things to take care of our skin and take care of our teeth, all these things.
Every day. Yeah, and that's a good point. People that are having back pain, neck pain, that's actually your body's way of telling you that there's a problem there. And most people, they say, well, maybe it'll go away. Mm-hmm. And sometimes it does, sometimes it doesn't. And they'll just kind of push through it. Well, your pain is your body's way of telling you that there's something wrong. So that's one of the things that I see a lot of times is people wait way too long.
Right.
Or they just resign themselves to having that pain, and they try to mask it with painkillers, and they go on and doing this for years and years and years, not realizing that they're just continually doing more damage, not to mention the problems from taking the pills. Mm-hmm. I think it's interesting to know that pills like aspirin kill over 17,000 people every year.
Wow, 17,000 people.
More than AIDS. So it's not a, people think, oh, it's just aspirin. Well, yeah, it is. But a lot of people, get gastrointestinal bleeding from that and a lot of different problems. So masking the pain is not always the best way to do it. It's best to just address it, figure out what's going on, and then get it corrected quickly so that you're not just making it worse and worse and worse. Pain is there for a reason. It's a signal telling you that there's something wrong. So, that's one of my main tips that I can give you about that.
All right. Okay. So tip number 1, don't ignore the pain. Get to your chiropractor before it, becomes really, really painful. What would be tip number 2?
A lot of people sit way too much. I mean, we should be doing this standing, really. But sitting puts more pressure on the little discs that are in between the bones of the spine than any other position. And people get into a lot of trouble by sitting too long. Our bodies have circulatory systems, of course. They also have what we call a lymphatic system, which is our body's drainage system. It's like the garbage disposal system of our body. And we have lymph channels through our body, just like we have blood vessels. And that lymph doesn't have a heart to pump. It requires motion from the body to do it. So when we're sitting all day, that lymph can sometimes stagnate in our bodies and make us sick because the garbage is not really getting taken out. So we need that movement throughout our day. And as I mentioned before, sitting puts so much pressure on the spine that it really we weren't designed to do that. We were designed to be running out in the jungle along the trails, So when we just take that person and we sit him on a desk for 8 hours a day, you can imagine that we're going to have some health issues associated with that. Oftentimes people won't drink enough water when they're sitting like that as well, which is a real problem again, because now the lymph and the blood can't flow as well and we get dehydrated, and that can cause, oh my God, that cause a whole host of other issues. So I would say my other tip would be, they're actually designing desks now that you can stand up. And I even saw one the other day that had a treadmill on it.
Nice.
And the people could actually walk at about 1 mile an hour, which is a very slow pace. And they found out that it was extremely beneficial.
Yeah. And it seems like there would also be something that would get your brain going a little bit more about that too. Like I know if I'm on my phone, I'll pace around my house. I rarely will ever sit down. I'm always kind of walking.
That would be the tip I would have for everybody, is to do that whenever you can. If you are in a cubicle or you have to be sitting, I would make an reason to get up at least once an hour and take a trip to the water cooler or something.
Right.
So that you're at least getting a little bit of movement in every hour. The same is true when you're driving, by the way. Trips should definitely be broken down. I know I've been very guilty myself of when I get in the car, I don't want to stop until I get there.
Right.
But actually, it's really not a very good idea. You should actually stop every at least 2 hours and get out, even if it's just to get out and do a few jumping jacks, walk around your car a few times.
Right.
Very beneficial. And when you get there, you won't be so trashed as if you were just to try to, get out of the car after driving for 3 or 4 or 5 plus hours.
Right. And a lot of times, if I'm traveling and I have my dog with me, that works as a good kind of trigger for me to have to pull over, because I'll say, hey, let's check out this rest stop and, hang out for a second. And just getting out, just getting some fresh air, I think also helps to make road trips less painful.
Sure. But it's really that movement that makes the big difference. Just sitting in general we're really not designed to do that for very long periods of the time. And so getting out and moving is very, very important.
Okay, so we've got don't ignore the pain, don't sit too much, or if you do sit a lot, integrate some more activity. What would be the next tip?
One real simple tip that especially men can use is don't wear a wallet in your back pocket. Don't sit on it.
Okay.
I got rid of my wallet many years ago because it's very important that the hips be level. And if you put a wallet that's that thick underneath one hip, look what you do. You raise it up. Now, that is like the foundation of a house. So what happens to your house if you raise the foundation up like that?
Right.
You're going to start having some structural issues in the house. Like what's going on in my house right now. So I know about this. And so you want to have those hips as level as you can. So taking that wallet out and sitting on a level surface is very good. Otherwise, it can, over the time, it can actually start to cause a curve and a bow in your back, which can then lead to disc problems and things like that. So I actually, years ago, just got myself a money clip. And this one is pretty cool. It's designed so that it holds all your credit cards, and it also holds your cash on the other side. And it just slips in my front pocket. Now I'm never sitting on it, but I've got everything that I would need,
Right.
Like all my cards are in there that I need, and I don't have to worry about it. When I had a lot of other cards, I just leave them in the glove box in the wallet in my glove box. So I'd have them there if I needed them, but I didn't really have to carry them around. So that's another, just a real quick tip that can help with lower back issues.
Definitely. Okay, so don't ignore the pain, don't sit too much, don't carry a wallet in a back pocket. And I know what you mean, because I've known people who one of the pockets of their blue jeans will be all worn from always having the wallet in there. And you can imagine, well, if it's wearing out the blue jeans, what is it doing every time that you're sitting on it? All right, so what would be the fourth tip?
Another real good one is your sleeping habits. You want to make sure that sleeping on your stomach is probably the worst position that you could sleep in for several reasons. One is you're not going to sleep like this, so you won't be able to breathe. So you have to turn your head. So you're sleeping 8 hours, hopefully, with your head like this. Well, if you've ever been on an airplane and you're talking to somebody next door, I mean, it's very uncomfortable to sit there with your head like this for hours at a time. So that can cause a lot of strain on the neck muscles and the neck, spine itself. And also, when you're sleeping on your stomach, there's no support for your back. Your back tends to kind of, your stomach kind of sinks down and it puts that arch in your back and it can kind of jam your lower back together. So the way I recommend my patients to sleep is on your back. And if you're having back pain, you can actually put a pillow underneath your knees to kind of support those. When I was even having some back issues myself at one point, I actually put a sleeping bag underneath it because it was taller than a pillow and I could really get my legs up there. Or sleep on your side. And I like to also get a big pillow and I hug that pillow because sometimes when you sleep on your side, if the arms cross like this, you can actually cut the blood flow off into your arms and you can wake up with numb hands. So if that's happening to you, you want to get one of those big body pillows or just grab a hold of whoever's there and keep your arms around that so that the blood supply stays open there. And that's been very beneficial for people as well. They also make a whole host of different pillows that are designed if you're sleeping on your back or your neck that hold your head back like this. There's a normal natural curvature to the neck and it goes to the front. It curves to the front of the neck. And that pillow will push up and help to support that curve there. And that's very important because a lot of times people pile up pillows and pull their head forward like that. Now, what that does is it straightens the curvature of the neck out, which is not what we want. So getting one of those special pillow, if you don't want to get a pillow, you can actually even just roll up a towel and wrap a pillowcase around it and put it behind your neck and so that your neck is back like that. And that can be very helpful. Don't be surprised if you get a little bit sore from doing that initially because you're going to be retraining bones and muscles and ligaments to hold that position. But in the long run, it's very helpful.
Great. So what would be our fifth tip?
Let's see.
Maybe the sitting too far forward like you mentioned.
Oh, yeah,
I know a
that's
lot of people that...
keeping the head down is a real problem. When people are reading like this or they're always down like that, they're flexing their head forward. Now, in between the vertebra are the discs, and the discs are like little jelly donuts. They're kind of, they've got the hard part on the outside, but the inside is this really gooey stuff. It's called nucleus pulposus, and it's in there. And when you're flexing that head down forward all the time, what it does is it kind of pushes that stuff to the back of the disc of the spine, and eventually it can cause those discs to bulge. And when they bulge, they'll oftentimes hit against those spinal nerves there.
Oh, wow.
So we want to try to keep that head up as much as possible. And I've noticed that it's quite a challenge. I'll be trying to read in the morning, and my first way to do it is to try to do this. So I'm having to kind of hold my book up and, cock my neck up and kind of read like this to keep that neck. It really does take some practice because I think a lot of us are just in the habit of keeping that head down.
Very hard.
And I can tell you from personal experience, it can really lead to some problems.
Is that what also contributes to, as people get older, a lot of times you'll see them get more and more kind of hunched forward. And as they get older, like it seems harder and harder for them to lift their head up straight and get that natural curve of the neck that you're mentioning. Yeah,
that's a good point. And what'll happen is people's head, as it goes down, it'll go forward. So now the head isn't centered over the shoulders. It's way out in front. And when that happens, then the shoulders start to round as well, and they get that hunched back there.
Wow.
So in my clinic, I do some special adjustments to help bring those people back upright, get them standing up straight, get their head centered over the neck. And it actually keeps their spine from wearing out a lot more prematurely than it would if they didn't do anything.
Wow.
So that can be another big tip for people.
Excellent.
Keep that head up.
This has been excellent. We had don't ignore the pain. We had don't sleep on your stomach. Don't spend too much time with your head hunched forward like that. I think that's a big one. Don't spend too much time sitting, and don't keep a wallet in your back pocket.
Don't sit on it. You can have a wallet if you want to. Some people are real attached to their wallets.
Right.
It's fine. But just when you get in the car or the truck, or you're going to be sitting for a long period of time, stick it in your front pocket or set it down.
Excellent.
Yeah.
Well, thank you so much. This has been so helpful.
I hope it helped. Yeah.
All right. Thank you so much for joining us. I hope that you enjoyed this video. Be sure to leave a comment letting me know if you've ever experienced back pain and if you've ever had a chiropractic adjustment. Be sure to subscribe to the Psyche Truth channel so you can see all of our future videos. Hit that like button if you liked this video or if you learned anything in this video, and I look forward to seeing you again soon. Thanks for watching.